Bismillah ar-Rahman ar-Rahim. Assalamu alaikum wa rahmatullah. Hello everyone, welcome again to Ziada Academy, and I will talk today about the fourth common cause of the common causes of painless red eye to complete the series of the painless red eye. So I will talk today about the pink eye or dry eye. So simply, what is the dry eye? The dry eye means that the tear film, which is composed of three layers, lipoid layer, aqueous layer, and mucinous layer, this tear film is deficient. Either the two inadequate presence or secretion of the three layers, or the two loss of one of these layers, which may disturb the distribution and the coverage of the ocular surface by this tear film. So the tear film is composed of three layers. The outermost layer is the lipoid layer, which is secreted by the meibomian glands, which are present inside of the upper and lower eyelids. And they are secreting these lipids through their orifices, which is present on the lid margin in the upper and lower eyelids. The intermediate layer is the aqueous layer, which is secreted by the lacrimal gland, which is located at the upper outer part of the orbit. And then the innermost layer is the mucinous layer, which is secreted by the mucous glands of the conjunctiva present on the ocular surface, or pulbar conjunctiva. Then it is regularly distributed by the blinking all over the ocular surface to wash it out, and then the tears are collected to the medial part of the ocular surface. Then the tears find their way down to the nose through the lacrimal passages. So obstruction of these lacrimal passages leads to defective drainage and epiphora. And if part of these tear film layer producers doesn't work properly, the tear film will be deficient. So the dry eye means that there is a problem with the tear film production or tear film integrity and stability of the ocular surface. So the ocular surface should be smooth and regular and normally integrated to be covered properly by the by the tear film. Either we have a normal tear film but irregular ocular surface, or we have a good and normal ocular surface but deficient tear film. In both situations, we will have the features and symptoms of dry eye. So simply, the dry eye common symptoms will be stinging or burning sensation, the foreign bud sensation, excessive tearing, and this is not logic. If you find it, if you judge it with the mind, you will find it unlogic. And I am hearing this comment from my patients. How I have dry eye and at the same time I have excessive tearing. Yeah, you have a dry eye time, and this will send impulses to your brain, which will give orders to the sources of the tear film to produce excessively their own secretes or secretions. So you have a time of dryness followed by the time of excessive tearing as a reflex tearing. The patient may complain from sandy or gritty sensation. Also the blurring of vision, one of the common causes. So we are putting in consideration the dry eye as a cause of blurring vision, especially after refractive surgery like LASIK surgery. Also the redness as a source of trial of the body to compensate or to correct this problem. At the same time, you will find a lot of production of excessive amount of mucin, which will be collected at the angles of the eye or the froth, the frothy tears. Finally, all these symptoms and these signs will express the dry eye in different ways with the different severities. So the dry eye is a syndrome of bilateral ocular irritation that is worsened with exposure, being outside in the wind, wearing contact lenses, blepharitis, extended screen time, and so on. The suggested causes of the dry eye may be due to evaporative dry eye, which most common cause is blepharitis in this case, like obstruction of the meibomian glands caused by blepharitis and leads to finally deficient label layer, and so the surface tension of the tear film is decreased, and then the tear film is not kept in place, and it will evaporate faster than normal. So it's called evaporative dry eye, which is commonly present with blepharitis, meibomian gland obstruction, and also increased screen time. Tear film deficiency, which is real deficiency of production of the aqueous part due to inflammation of the lacrimal gland, especially the autoimmune diseases like Sjogren's syndrome. Meibomian gland dysfunction. The meibomian glands are with normal texture and with patent orifices, but they are not secreting properly or normally. So we have to find the diagnosis of this dry eye to treat it properly. We are compensating with this ocular surface with artificial tears, which will act as a helper for the ocular surface to be wet and moistened all the time and to correct the symptoms and signs associating this dry eye. So, because of blepharitis is related to the dry eye, which we have talked about, so the blepharitis will be the 5th common cause of painless red eye. Let's talk it in the next lecture. I hope it beneficial for you. Thank you and see you. Bye-bye.